quote that Carolyn gave about dreaming bigger than our fears. It seems to be what we're doing here at SIUE and across the nation, colleges and universities, as we plan in this unprecedented time of COVID-19 and Black Lives Matter and a upcoming presidential election. So there's a lot going on college campuses. So I have some slides here to share with you. We'll take questions at the end. We'll try to, there were some questions that were raised ahead of time. And I'll get to those. They're scattered throughout here. I added a little bit more than what was asked. And so we will go from there. So let me get this thing moving. So I'm going to start kind of an overview about what we're doing on campus. We are, as we can, going to keep a low density on campus. Our faculty, our staff are working on working remotely where possible. That's to coincide with the Restore Illinois plan, as many of you are probably aware. We're still doing a lot of Zoom meetings and team meetings and using technology. We've become more technology proficient, I think, since March than we originally were. And we've been able to move a lot of things online and virtual. We are developing through the IBHE, Illinois Board of Higher Education. There are training programs that we need to provide to all employees and students on what the return to campus will look like, our mask policy, our how do you report if you have COVID symptoms, what do you do in each situation, and that training program is about ready to head out to our community starting next week. I should mention, even though I didn't put it in here, this upcoming Tuesday, we are 2 weeks away from move-in for our students onto campus into the residence halls. So things are ramping up on Friday, this upcoming on the 7th. The School of Pharmacy starts their fall semester. Our resident assistants arrive, so we're getting ready to ramp up very quickly here. I do want you to know, and I think this should not shock anyone, face masks are required on our campus. We have a lot of marketing and messaging going out on that. It's required in most every place. I have the next slide will say where it's not. And I would say for the most part, I've been on campus now all the whole month of June and July. Our faculty and staff are adhering to this, and we have face masks all over campus. So if students forget them, or faculty staff forget them, or visitors need them, we have some for free. We have some that will be purchased. I actually have, our students are getting, each student is getting one of these nice, lovely face masks I'm putting here over my face. That will be a freebie for them. We actually, every faculty staff member gets a free face mask as well. Obviously people have their own, but face masks are required. There's some places where they're not. And so, you know, I'm in my office right now. I'm here by myself. I don't need a mask. So offices, if you can remain 6 foot distance, you don't need them. We will have students living in. I'll talk about that in a little bit. Obviously some health things that you can do there if you're working out. And obviously if you're eating or drinking, you can't do that through a mask. These are some of the ways that you are allowed to not wear a mask if you're on our campus. If you are visiting our campus and you are a visitor, you will be required to wear one as well. We'll talk just a minute about academic instruction. I know we're watching what's happening in the K through 12 schools. And a lot of schools are thinking about going virtual, and some are doing hybrid, and some are doing face-to-face, and some are delaying when they're going to be face-to-face. We will have 3 different ways of delivering instruction. Masanda knows this. We have about 37% of our 3,500 courses will be face-to-face. Some will be hybrid, meaning on one day you'll come to class and the other day you'll be online, and some are completely virtual. Something our provost has said over the course of this period, she's now become not a fan of fixed seating. We have a lot of fixed seating. Restore Illinois says you can have a max of 50 in the classroom, and you still have to be 6 foot socially distanced. When we looked at our facilities, we only had 5 academic classrooms that could hold 50. So we're using space in the Morris University Center and Campus Rec, and in housing, we were able to add 6 other spaces. All the rest are in smaller classrooms or online. Student schedules changes went out this past Friday. So we're starting to see the residual effects of that, where students are saying, cool, I'm coming. No, I don't want to do that. We're seeing some of that in housing too, that all my classes are online. Can I withdraw from housing? Yes, you can up to August 1st. So we'll see what those numbers end up. But as of last Tuesday, we were only 4% down in total enrollment, which is quite amazing given the time that we're in. The academic calendar's been modified. We'll be ending most classes by November, by Thanksgiving. Some classes will still meet on ground after Thanksgiving, and the residence halls will remain open until December 18th. We have several students, when we moved them out in March, said to us they rely on us for basic health care, computer, technology, living, those type of things. International students can't go home, athletes can't. We have a bunch of students who will need to stay with us, so I wanted you to be aware of that. Face coverings will be required in all classes. If a student can't adhere to that, we're going to probably move them to an online course. We're very serious about this. Also, want to let you know that right now the plan is that we will not start on-ground classes in the spring until the Tuesday following Martin Luther King Jr. Day, and we will be eliminating spring break in order to get the 16-week instruction period in. We're working on the spring schedules now, and we've already signaled that to our students. So once you be aware that from about December 18th to January 19th, there won't be a lot of activity on campus as our students will not be here. I mentioned this earlier, visitors, and that's just not the building, visitors will need to be wearing masks. We have markers all over the floor. We have queuing lines. You'll be able to see, it's pretty visual what the plan is and what people will be expected to do. We can only have events of 50, so we're modifying operations for that. We'll have limited indoor seating. Hours are going to be reduced because through guidelines, we need to be cleaning our facilities a lot more. So now to get into kind of the health and safety of campus, since March, I know there's a stay-at-home order, but health services has been operating on our campus. And so we will continue to do so and provide a full array of services to our students and faculty and staff. We have a really strong relationship. Rianne Greenwald is our Director of Health Services, and we have a strong relationship with Madison County Public Health Department. We are in contact with them daily on all the changes that are happening in the region of health and monitoring the positivity rate of the county, along with St. Clair, and then of course monitoring what's happening in Missouri, because many of our faculty and staff and students go across the river. So we're watching that. And Rianne, I'd be remiss if I didn't put this in there. She's telling me, get your flu shot. That will be important as we fight the disease. Counseling services, the same way. We've gone to a lot of teletherapy and telecounseling. And so we've continued to offer that throughout since March, and we will continue to do that in the fall. Career development as well. An interesting thing, we've had all our career fairs are now virtual. We've been so face-to-face, but we're still offering appointments through virtual and through face-to-face. A thing here at the bottom that maybe you're not aware of, we have a Cougar Career Closet where we accept donations for suits and ties and blouses and things, and we have a whole closet. It's actually a big, massive room. And our students who are less fortunate or don't have the ability to purchase these type of things for interviews and internships can come and get a free outfit from us. If you're thinking about a project in the future that maybe you want to support or fund, that would be a great idea. That's my shameless plug. Our Early Childhood Center could not open until July 6th, but it is open, serving our faculty, our staff, and our community. They have so many agencies providing them guidance. One of the major things in there is we have to screen all staff and students before they enter the facility, and that's before 9 a.m. And so we have a lot of things in place there, but we're serving a smaller group now, and then we get to increase to almost full capacity on August 7th, which is quickly approaching. It's probably the big question people want to ask: are you going to house students? Yes, we are. And this is similar to what other public and private institutions are doing. We're kind of fortunate that in our first year halls, in our upper class halls, we have many suite style, so it's not a lot of people sharing a bathroom. It's 2 or 3 people to a bathroom, sometimes 1. We put out the call for housing in the beginning of March, and so pre-COVID we had about 260 first-year students who signed up to live with us, and ironically, from April to June, that number increased to almost 1,000. And only about 250 of those students wanted singles. The rest wanted roommates, which is kind of tells you what they're thinking about in this COVID environment. We've kind of backed off on that. The most we're going to have in a space is probably 3 to a bathroom. And we're going to have cleaning and things available. We also have isolation rooms. So if students come down with COVID or the flu or other things, because there are other communicable diseases, we have isolation space in all of our residence halls, including Cougar Village and Evergreen Hall. And so we'll be able to put them with their own bathroom, their own space, and provide them support through meals and health services and those type of things. So we've changed move-in. So I don't know if you know this or not. You may be the first public group hearing this. Move-in is now a 5-day process. It used to be a 1-day process. So on Tuesday, the 18th, move-in will start. We are only allowing a student and 2 guests to move in. We will not have movers and shakers. They have a scheduled time frame. We're limiting how many people are in a wing at the same time, so there's not a lot of people interacting. That's why it's a 5-day process, but that will start on the 18th. So you'll start to see those type of folks in our community starting on Tuesday the 18th. Hey, we got dining. We're still feeding people. I'll tell you about the protocols in a minute. We're actually renovating Chick-fil-A right now. If you don't know, other than Fairview Heights, it's the only Chick-fil-A around. As a community member, you can come there. It's going to be a full service Chick-fil-A now with milkshakes and salads and all. It'll have its own separate entrance that's different from our center court area. We just put a new Starbucks in the library. We were getting ready for the grand opening in March, and then COVID hit. So our university's not been able to appreciate that new place. We're adding a new pizza concept where Pizza Hut was. It's called Pavo's. It's kind of like mod pizza. It's kind of make your own, but our staff will make it for you. It's a 3 or 4 minute process, but we also have grab and go and things there. So some new dining options for our students. And if you're not aware, we have a muck truck, which is a food truck that kind of rotates throughout campus. It's really out here between Peck Hall and Rendleman between 11 and 1, and it serves barbecue, and it's pretty cheap and it's really good. So if you're ever around on campus, come here and eat. Here's the dining stuff that I wanted to share with you. We have queuing lines and so many people in center court at one time. There'll be limited seating. We have all these safety measures. A big plexiglass has been established around all our dining locations and our cashiers. We're telling our customers it's going to be slower because you still have to maintain 6-foot social distance. There's placards on the floor. We're asking people to move toward almost a cashless system. So using a credit card or what we have Cougar Bucks, which is our meal card that you can put money onto. So we're just trying to limit the amount of touching going on, but we will be feeding people during this upcoming academic year. Another question that was asked about campus life. We're still going to have events that's going to look a lot different. Things are going to be open. We'll be able to do in-person or virtual appointments. Student organizations will still meet. They'll meet differently. We're waiting for the direction from the NCAA and what to do with intercollegiate athletics. You may know the Ohio Valley Conference, that's the OVC. We won't be starting athletic contests until mid-September now. Other conferences are doing different things. The quad will be closed for non-university events. We're trying to reduce the amount of people coming to campus, and there's a lot of things we don't want people touching. So that's kind of what that is there at the end there. Our Student Fitness Center is open through the Restore Illinois guidelines. They'll be at 50%. We're asking students to kind of bring their own stuff. No, they won't be required to wear face masks. We will be offering, we think, intramural and club sports. I know the guidance came out yesterday from the governor that had to do with IHSA, and that was everybody up to K through 12. It didn't include guidance for colleges, universities. So we're trying to figure out what that means and whether we're going to use that system of high, medium, and low. If we're going to use the 1, 2, and 3, 4 criteria they have for what you can do. So we're still waiting for that guidance to come out. Textbooks, you may not know this. We have a textbook rental program. It's one of the few programs in the nation where students pay really about a $230 fee a semester, and they get all their textbooks, which if you have a college student, you know that's pretty cheap. I know my daughter was in nursing, and we spent $1,000 some a semester on books. So we have 3 ways for students to get them. We're really encouraging pre-order, and they'll come and show their ID, and we'll go get their books. But they also can come into our physical space and get their books, and we can mail them to them as well. A question was asked about funding. You might hear about the CARES Act. We were awarded about $4.8 million of direct funding that went to students. We had a process for that. We only have about $600,000 left in the fund. And then we had the Cougar Emergency Fund, which I think many of you helped supported. We had about $50,000 in the account that went to help students that maybe weren't CARES Act eligible, that were maybe international, that were DACA students, or students that didn't meet the CARES Act criteria. We've burned through that account. I think we have maybe $2,000 left. And so we're probably looking for another push to help fund that as we move into fall and into spring. Some last things here on training. So we have a Clear the Air campaign. AIR stands for Ask, Inform, Refer, and that's really about our mask policy. So if we're asking our folks on campus and we're having people armed with masks if they don't have one on. Here we're going to ask them, we're going to inform them why it's important, and refer them if they refuse to wear one. Either refuse to HR if you're an employee, or refer to my office here if you're a student who won't comply. So we have training for all our staff. We have FAQs on all situations. So what happens if I'm a staff member and someone tells me I have COVID, or I got tested, or I'm feeling bad? And I have to think about all these things. And like I said, we have a great partnership and communication with Madison County and St. Clair Public Health. This is our website. We actually have a coronavirus. It's on our main page. So if you visit siu.edu, in the middle of the page is coronavirus. If you want to see, if you care to look at all things coronavirus, way about campus, has every communication we sent to campus, all the updates, all the things happening, and what the plan is, and also a way to contact those of us on the core team. I must mention myself, the other vice chancellors, and a few other folks are on a core team. We've been meeting in March. We met like every day, 2 times a day. Then in June, it went to every Monday, Wednesday, and Friday. And we continue to meet every Monday and Wednesday and Friday throughout the summer, and we'll meet throughout the fall as we navigate our students returning to campus. So with that, I'll take questions that you may have.
If you have a question, just go ahead and unmute yourself and fire away.
It's rare that they silence a crowd.
Yeah.
So.
Hey, Jeff, your question is just, where everybody's kind of figuring out how to navigate things like this. And if someone is positive in a classroom, is the university, mandatory that everyone in that classroom has to quarantine, or how are you guys going to kind of communicate, things like that?
So great question. We are asking all our faculty and all the on-ground classes to have a assigned seating chart. And this is important for contact tracing. So the process is, and it's challenging for our folks to think about how this happens, but this is how it happens. The Madison County Public Health Department will know who the positive is. They will get the list of the class. They will contact those folks and say, hey, there's been an exposure in your class. Here are some things you need to watch. We will physically shut that class down and clean thoroughly. And then that, I would guess, the process is that class will probably move virtual for a while until we have, if there's any more symptoms, if any more contracts the disease, and we're hoping that won't happen in all the classes, but all our faculty are prepared to move things virtually if we need to. Now, there are things, Kevin, that I will tell you, you can't do chemistry lab virtual. Any chemist or any biology,
right?
You can't dissect a frog virtually, and you can't build a car through engineer virtually. So there are things that will be a challenge for us to do, but that's really the plan. And it's different in housing. We get a few here. We moved into isolation. We hope that takes care of it. We have a great partnership with Anderson Hospital. And I said, Rihanna is our director of health services here. And then, oh my gosh, Laura Bernay, our dean of nursing, is on the board for Anderson. So we have a partnership with them if we need to move students out there. And the thing to think about, which is really interesting, as we've been discussing this, is we only have about 2,000, maybe 2,500, somewhere in there, of our total 13,000 students living on campus. The rest live in our community. Many of them live in our community, and some are online far away. But you look at places. I'm more concerned about our students who live at the Reserve and Axis and Enclave and Greenfield Village and all the apartment complexes out there, because they'll have to rely on the healthcare system, and they'll have to isolate, we hope, on their own. We will encourage students, if they can, to go home, wherever home is. And even if students contract or in our housing, we will be talking to parents and saying, hey, your son or daughter, they're here. If you want to come get them, that's cool. If you want them here, we're trying to work through this, but really a classroom piece. And then we might go back in to on ground, but we'll see.
No, thank you. I was just curious.
Yeah.
Appreciate it.
Any other questions for Dr. Waple? Well, hearing none, Dr. Waple, I'd like to thank you for putting together that presentation and sharing it with us. There was lots of good stuff to hear about going on at SIUE, and it was especially encouraging hearing those enrollment numbers that have been minimally impacted. The teletherapy sessions that you have available for the students, if you should want to do any practice reviews or something like that, I might be able to refer a couple Rotary members to you if you'd like to check that out as well. So
sure, yeah, I'll send that to my team. I will add, there have been so many people in our institution that have been working hard to figure this out, and probably like many of you in the roles that you have in the community. And the guidance changes almost every day. And that's probably one of the frustrating things, is that you start moving a direction and then boom, we go, or you're waiting. We were waiting in May to hear what June will look like. And then, 2 days before the stay-at-home order, we get the next direction. And of course, every time we put something out, it leads to more questions because the guidance is guidance. And it's our government trying to figure out the best they can. I hope that our Madison County, St. Clair County, I hope our residents, and especially our younger residents, are paying attention to their health. I hope that we don't have to go back in a phase. I mean, I don't think any of us really want that to happen. And so we're sending a lot of information out to our employees and our students about, hey, the next 14 days, we were trying to protect, you want this experience on campus. Our students have said, we want the college experience. Well, in order to do that, you got to stop going to parties and Ballpark Village, and because they're not smart enough not to post it on Facebook and Instagram. And we're just trying to that message too. And same with our faculty and staff. You know, don't take that vacation to Florida. Florida's a bad place right now. You know, there's a map that we're using from Harvard that shows the positivity rate in counties across the United States, and almost every county in Alabama, Mississippi, Florida, and South Carolina are red, which is bad. But St. Louis County and City of St. Louis and St. Charles are also red right now. And you're seeing that in the news as the positivity rate keeps moving up across the river. So if you're traveling across the river, we have the 3 W's: wash your hands, wear a mask, watch your distance. And if as long as you're doing those health things, I think you'll be okay. We know that other people are not doing that. I see Masanda ask a question. I thought we were done, Masanda. Thanks. So really, the partnerships with our external housing units are at arm's length. We've reached out to them to help support them, and I'll tell you, Enclave is probably the one that responds to us the best. Access is a challenge. Green Hill does okay on occasion, and the Reserve kind of does too. But you know, we've reached out to them and say, hey, what's your health plan? And not getting a lot of response. How are you going to manage an outbreak and I don't know if they're managing that from a central level or not, but we've done our outreach to them in hopes that they will be ready. I don't think anyone on this Zoom call thinks that we won't have students in K through 12 and college that will get COVID. I think that's inevitable. If you're watching the news, just based on the return of some college sports to campuses and the things that are happening. Mm-hmm. I think there was just a report today in the New York Times that in the last month, 6,500 new cases have been related to college students. And we're not in session yet. So we're trying to figure this out. I'm hoping that we don't have to go all virtual. I'm hoping we don't have to go back to March where we send everyone home. I think everyone is hoping that. I'm hoping as a community, we don't have to go back to the way it was in March. As small businesses and other businesses need. So we're just hoping that everyone is following the healthy lifestyle we need to do to keep this thing going. So.
Well, couldn't agree more. Thank you.
All right.
All right. Let me pull your attention, everyone, to the chat box. There's been some additional information. Lois's bench dedication is set for 3 o'clock Wednesday, August 5th at the Children's Museum. Interact, Tina got a response back from Nicole. They would ask that if you hang on to your plastic caps whenever they start collecting them again, because they've run out of places, they've run out of storage for that. And what else was there? Sleep in Heavenly Peace has a build August 15th in the morning, 8:30 to 12:30 at Grace Church, if you want to volunteer to help with that. And I think that'll take care of those updates.
Is the Grace Church, is that the one in Fairview Heights?
I don't know if it's the one in Fairview Heights or the one in Granite yet.
So Fairview Heights.
Fairview Heights?
Yes.
Good deal. Thank you.
Mm-hmm.
Okay, next week, Dave Viox has the program. I've heard bits and pieces about it. You're going to want to be here to watch that. So that's cool. And without further ado, we'll go to the 4-way test. And then we'll spend the rest of the time in breakout rooms. So feel free to go there and spend whatever time you can. Masanda, do you have the 4-way test ready?